I'm Salman Fazal and I live in Wexford, Pennsylvania. I'm the director of the cell transplantation program at Allegheny Health Network, Pittsburgh, Pennsylvania. Apart from working in the hospital and spending time with my wife, I love playing squash. So if you're not going to find me at home or at the hospital, you'll find me at the squash court. I grew up in Pakistan and graduated from King Edward Medical College. It is one of the top 3 medical schools in Pakistan, and I graduated from there, came to Chicago, did my residency, and then I came to Pittsburgh and never left Pittsburgh. I love it. So I felt that in Allegheny Health Network, we did not have a dedicated center where patients with MPN can come in and enroll in the groundbreaking trials that are available for this disease. So we will be watching your hemoglobin very closely. As you know, so when I'm talking with my patients, I'm telling them about the pros and cons of the clinical trials. I'm also telling them what is the science behind the neurotherapy, which I think allows me to gain the trust. But usually liver is usually larger than the spleen. One of the therapies that we evaluate these patients is allogeneic stem cell transplantation. I tell my patients that allogeneic stem cell transplantation is the ultimate immunotherapy that we have available for malignant hematology patients for a very long period of time. So you were having symptoms with phlebotomy? So I know that patients understand immunotherapy. They understand that how we can leverage the immune system of a donor to cure this disease. However, that immune system from the donor can be their friend and cure their disease. However, could be foe and can cause complications such as graft versus host disease. And one of the other key elements in my care of my patients is the compassion. I will admit that I learned compassion for my patients from my unit nurses. I'm not the same physician that graduated from fellowship 15 years ago. Now I have learned a lot about how to take care of my patients and how to meet their expectations and their needs. I'm glad that MPN is now recognized as a separate entity and allows us to dedicate resources for research for this disease. However, this is not going to be possible without physicians who are interested in this field, and I'm happy in my role to inspire other physicians to take care of these patients. I certainly think that managing these patients and the compassion that I show for my patients allow me to inspire a new group of physicians to take care of these patients. After I've been working as an attending, I was awarded as a teaching faculty in our fellowship program. And I can happily tell you that there have been fellows that after they finished their fellowship, started taking care of patients with myeloproliferative neoplasm because of my impact on their training. And that's the biggest challenge, is that how can we predict the odds of transformation to acute myeloid leukemia with myeloproliferative? I don't think there's any better feeling than that. So I'm really excited about the future. Now we have 4 FDA-approved therapies for myelofibrosis. We recently had a FDA-approved therapy for polycythemia vera. And I believe that we can change this disease management from palliative to disease-modifying therapy. So I'm really excited about the future, that we will have, hopefully, combination therapies that can now alter the natural history of the disease.